Will now be recorded.
We can hear it's a little quiet.
I'm a registered nurse and foot care nurse. I'm also a nursing foot care instructor and have been in business for more than 20 years. I'm so excited to come and talk to you today about the Onifix nail correction system. This system is phenomenal. It has changed the way I practice on a daily basis. It's benefited so many of my patients, and I'm just so pleased with it. The Onifix nail correction system is a brand new, revolutionary nail correction system. It's not a brace. It's a nail correction system. There's no torque involved. It is absolutely pain-free, non-surgical, non-invasive, evidence-based medical device that is suitable for even your most high-risk patients. It has many, many uses. It can be used for ingrown toenails, involuted nails, pincer nails, onycholytic or detached nails, split nails, pedaloid nails. It works wonderfully for acute or chronic relief. It can be used in nail restoration, reconstruction, and as a surgical adjunct for both your PNAs and TNAs. I don't know why this isn't in every practice already, except that it's fairly new. So you're getting in right as it's being introduced to the US. So we all know that involuted nails cause pain, inflammation, and put our patients at risk for infection. What's the theory behind Onifix? I was actually really surprised to learn it's so simple. Basically, most nails grow straight at the matrix, but end up curling in the nail bed because sometimes the nail is just too wide for the nail bed. To compensate for the lack of space, the nail ends up curling, following the path of least resistance. The Onifix, when polymerized or hardened, provides the support the nail needs to keep that straight shape from the matrix as it continues to grow. So with the support of the Onifix, the path of least resistance is no longer to curl. This is also why we place the Onifix as proximally as possible, as you'll see in upcoming pictures. Keep in mind, the skin has oils that will cause the bond to break, so while you want it close, you don't want it to touch. We want the resin to be there to help keep the straight shape without touching the skin. The Onifix will then stay on for the entire length of the nail as it grows out, as I've depicted in this picture here. So the dark blue band here, that would be where you put the Onifix on to start, and it's depicted as it continues to grow out. It will stay on for the entire length of the nail until it hits about the distal third portion of the nail. Then it usually dislodges and you'll require another proximal strip. It tends to dislodge when it reaches about the distal third portion of the nail, simply because there's more flex and there's more movement. When you get your Onifix kit, you're going to get a blue box, which is your product box, and you're going to get your a white box, which is your Onilux toolkit. So in your Onilux toolkit, you're going to get your cannulas that you're going to need to apply your soft Onifix. This will make more sense as we move along and you can start to see pictures. You get your spatula for spreading your hard Onifix, and you get an LED light to cure the resins and the primer. Now, I know that a lot of us have lights already in our practices, but it's really important to use this specific light. The Onifix compound requires a very specific power and wavelength to harden properly, and this is absolutely perfect. So I strongly suggest that you use the light that's in this kit. Then you also get your product box. Neuberg has been extremely generous with the amount of product that they offer. The startup kit alone has between 70 and 80 applications in it. So I guess they just recognize that it is a tactile skill. So they give you extra product to practice on, and you still have plenty left to implement into your practice. So what comes in that product box is you get your Onifix primer, your hard, and your soft. The Onifix primer is used to prepare the nail and increases the bond of the composites on the nail by more than 50% by dehydrating the nail. It is interesting to note when talking about the Onifix soft and the Onifix hard, they are the exact same product. Onifix is Onifix. Neuberg has just given them to us in two different consistencies for different uses and ease of application. So typically the soft we end up using, it has more of a glue-like consistency, it's runnier, and we typically use that on smaller nails, really thin nails, children's nails, or split nails. One thing I will say about the soft, it just seems to adhere better to nails that move around a lot. The Onifix Hard doesn't like a lot of movement. It'll dislodge easier, but the Onifix Soft really does seem to adhere. The Onifix Hard is more like a putty. It's a stronger compound. It's more dense, and you have to use a spatula to actually shape it. But we typically use this on the big nails and for strong deformations. Now, keep in mind, because they are the same product, you can use the Onifix Soft on large nails. You can use the Onifix Hard on smaller, thin nails. It's just for ease. So whatever you end up getting used to, people tend to be drawn to one or another. Either or is fine. We will go through a couple of different applications in just a second for your reference. So if you look at pictures 1 and 2, these are applications of the hard product. The first is your full proximal strip. So you're going to use this for somebody who has a chronic involution or a split nail. You can also use it for the restoration of unhealthy nails as part of your PNA post-op treatment. But you typically apply it as proximally as you can, 2 millimeters wide by 2 millimeters high, and that will continue to grow out as the nail grows. Now, Onifix Hard has another use too, and that is picture 2 there, this distal half strip. So when your patient comes in and they have an acute issue, they've got an acute ingrown toenail, let's say right here, when you remove the spicule, you can put your proximal strip on for long-term relief, but you can also put on a distal half strip where you've just removed that ingrown toenail from. And you remember me just saying that the distal third portion of the nail has more flex? Well, that's where this comes in handy. You can put the distal half strip on, and it's not going to stay on for very long because there's movement, but because there is movement, it actually will lift slightly, which comes so handy when you've just pulled out an ingrown nail and the flesh underneath is so painful, it's so swollen. Just that tiniest bit of lift provides them with such acute pain relief. Your patients will thank you for it. So I usually put on the proximal strip. I'll throw on the distal half strip just for my patients' relief and let them know, this is just for a temporary relief. It's probably going to fall off in a couple of days, but your patients will be really quite grateful that you did that. Now over here, the final 3 pictures are your Onifix Soft application. So you've got an Onifix Soft full strip. It's just a single strip, and you can use that on your smaller nails, your involuted. You can definitely use this. A great use for this is post TNA. It works really, really well. We'll discuss it a little bit more in a future slide, but keep in mind the Onifix Soft is the one you're going to want to use for that. Number 4 here, this picture, you'll notice the 4th picture looks just like the first picture. That's because when you apply a double layer of the Onifix Soft, it actually has the same strength and density as 1 layer of the Onifix Hard. So do you remember me saying that the Onifix Soft tends to hold on better to nails that move, that there's some onycholysis there, or they're very, very thin? If you ever have a patient that you've applied the Onifix Hard to, and let's say the Onifix strip pops off, chances are it might be popping off, if it's the hard, is because the nail is too thin. At that point, if the patient came back, I would put on a double strip, as you see in picture 4 of the Onifix Soft. It will probably hold on much better. I've had it work quite well on some patients. And then the last application that you can use for the Onifix Soft would be doing a whole nail double layer. Now this is for those really thin, flexible nails that say are split or need reconstruction. Again, I'm going to show you some pictures moving forward here. So this is an example of using it for onycholysis. It's for the active treatment and prevention of the nail detachment. It's really important when you do this that you trim the nail back as far as you can to the point of nail attachment. It has to be attached to the nail bed. And you want to use the soft product for onycholysis. The hard can be used if you have enough nail to hold on to, but the soft is much easier to apply in situations like this. This is for split nails, using Onifix for split nails. You always want to apply your strip for split nails horizontally. Many people are tempted to apply it along the strip vertically, and that just doesn't provide the support. The nail can still move and the split can continue. So always do a horizontal application of the Onifix. This is for the pedaloid nail. This is actually a before and after, and it just looks wonderful. You simply apply a full layer of the soft across the entire nail, and it does grow very, very slowly, but over time you can see the results there of the nail reattaching. Here we go. We were talking about using Onifix as an adjunct or post surgery. So with your partial nail avulsions, you can use the soft, you can use the hard for your nail avulsions. After you're done the procedure, many podiatrists are simply putting it on right after. Put a double strip on right after the procedure, and then, you know, review with your patient about 2 months later. They're likely going to need 2 applications of the double layer, but they're finding much better results for the regrowth of the new nail. Now, when you're dealing with a total nail avulsion, obviously you can't put anything on right away because there's no nail to grab, but have your patient come back after about 2 months when that little nail has started to grow. And this is where you want to make sure that you use the soft Onifix. That little nub of nail is so delicate that the hard would be too harsh to use. So apply a strip as much as you can on that new little nub of nail and reassess probably about 4 months. You might want to put another strip on to ensure straight growth. But this is a wonderful adjunct post-surgery. Here we go. This is just when you're using Onifix, the restoration of for healthier nails and improvement of the tissue. You can see from the picture, Onifix just really is really healthy for the nails. It can prevent the need to actually remove the nail entirely. We'll get into some clinical studies down the road and it'll make a little more sense then. And this is when you're using it for reconstruction. So the important thing to know, if you're doing nail reconstruction, you do need at least 15 to 20% of the nail plate as your base. And you're going to apply the Onifix soft over the entire layer in a double layer. Don't use the primer on the skin, though. You just want to use the Onifix and go straight over. This is a wonderful before and after picture of what it's capable of doing. We go. So when you do purchase the system, you're going to get a clinical video with it, and you can also request it at www.onifixusa.com. There is a clinical video we're happy to share with you. These are just the very brief, simple steps. You roughen the nail. You want to make sure you use a diamond burr to roughen the nail. It just provides a little more grit for the Onifix to hold on to. Clean the nail with rubbing alcohol. Apply a very, very thin layer of the primer. And then this step is very important. Many people skip it. You have to remember to cure the primer. Cure the primer with your LED light for at least 45 seconds. Then you need to wipe off the residue with alcohol, apply your composite, be it the hard or the soft, cure that composite for 60 seconds. So 45 for the primer, 60 for the composite, and you're ready to go. Typically, I encourage people to use a ceramic burr to smooth out the Onifix afterwards. You don't want to use a diamond burr because it's an infection control issue. The diamond burrs have pores and the composite can get stuck in those pores and you can't properly sterilize it. So use a diamond burr to prep the nail, but use a ceramic burr to smooth it out after. So some advanced techniques and guidelines.
I think it's a setting that I can adjust on the laser. Hold it up a little higher.
These are all very, very important, and so really maybe take note. They're just really important for making sure that you're successful. The overall size and height should always be 2 millimeters wide by 2 millimeters high, or 2 millimeters wide by 2 millimeters high. Now, if you don't know what that is, simply look to the body of your Q-tip before you harden it. I always just, when you see the clinical video, you just apply it, put it in your strip, and before you harden it, hold your Q-tip up next to it. If it's about the same size as the Q-tip body, you're good to go. You want to make sure that the strip is uniform. I get pictures all the time and they're bumpy. It's got to be nice and uniform. I tell people, think of like a rainbow on top of the toe. It's got to be nice and smooth and uniform. The strip, you're going to be tempted to apply the strip when you've got a really deep pincer nail in a U, following the shape of the pincer, because you're going to think you need to have more on the nail, and that is incorrect. Go against your gut on that. You have to apply the Onifix as straight as possible. And sometimes if you've got a really strong pincer nail, it's going to feel like you're hardly putting any Onifix on at all. And in that case, it's just going to take time. That first strip, you may not be able to have a lot of Onifix on without hitting the sulci. Let it grow out. And with each consecutive strip, strip. As that nail flattens out, you will be able to put more and more Onifix. But when you put it in the shape of a U or a C, it's not conducive because it actually weakens the and reduces the effectiveness of the Onifix strip. So please remember that. You want to make sure you're as close to the cuticle, but not touching it. And the same with the sulci. Even if you can just have 1 millimeter of space, just don't touch the skin. That skin has those oils that could cause that strip to fall off.
All right.
So we've got some gray zones. Typically when we're priming the nail, when you're buffing it with your diamond burr to start, we typically tend to stay in the middle of the nail, and we shy away from these areas that are in red, these 3 circles, but those are the most important areas to buff because those are where the edges of the Onifix is going to sit, and that's where it's going to dislodge if it dislodges from anywhere. So make sure when you're debriding that nail, you get right in as close as you can. Don't damage the skin, obviously, but get as close as you can. I always pull back on the skin and make sure I get as far as I can into those edges. And the same when you're priming, get that primer right in there.
Yep.
Burrs, we've talked about burrs. You want to use a diamond burr for prepping the nail, and post-application refinement, you want to use the ceramic burrs. It's quite important to not use water drills. Turn the water function off. We need that nail dry. Remember, the primer works by dehydrating the nail. Oils in the skin cause it to dislodge. We need that nail dry. So don't use your water drill. You can use, sorry, I skipped over something there. You can use disposable files if you don't have access to, you know, a ceramic burr or a rotary device. You absolutely can use, I just don't find they leave quite as nice a finish. And just a little tip, when you're applying your primer, most people think you need a lot. You literally need 1 drop. You take the cap of your primer and put 1 drop in, and that is enough to do an entire nail. If you put too much primer and you're going to have too thick a layer and it's going to be moist, thus detrimental to keeping that strip on. So just a very, very thin layer. And again, I did mention, if you have say a nail and the Onifix hard continues to dislodge simply because it's quite a thin nail, try putting a full strip double layer of the soft. There is an example of that comes with the clinical video when you get the system. So you'll be able to actually watch me do it on the clinical video. So that's a really good tip or trick. Something else that we've noticed too is that it doesn't happen often, but if you have just a real tricky nail and the Onifix continues to fall off, typically there's a significant amount of lysis or more movement to the nail. Try, when you apply your double layer of soft, instead of doing 2 by 2, try going 2 millimeters high, never go higher than that, but try going almost 3 millimeters wide. It's quite a wide stance, but sometimes that gives the Onifix the stable base on a very movable nail to stay. That's a really good tip to remember. When cleaning, only use alcohol, at least 70% and up. We don't want to be using other products like acetone. And it's also really important to only use non-linting, non-woven gauze sponges. Regular gauze or cotton swabs, anything like that is going to leave lint or debris behind, which is a big no-no, could definitely cause the Onifix strip to not bond properly. You can use alcohol swabs to do that. For your optimal results, try wiping with alcohol between each step. So when you put the primer on and you cure the primer, give it a wipe with alcohol, then put your composite on, harden the composite, give it a wipe with alcohol, then debride. Each step, it just makes sure that there's not extra, microscopic debris there to cause problems. Curing time, again, you want 45 seconds for your primer and 60 seconds for your either of your composite. Don't stint on the time. That's really important. When Onifix first came to North America, our times were a little bit lighter, and we did notice a difference when we increased that lighting time. The other thing you have to pay attention to is make sure your battery is at full strength. We'll talk about this a little more in a moment, but so many people don't charge their light. So the battery comes separate from the light in the starter pack. When you put it together, most of them will light up, and people think, oh, that's great. Well, there's no indicator light to tell you how strong that battery is or what charge that battery is. And if that battery isn't at least 50% charged, it's not going to give enough light, give off enough light to properly cure the composite. So when you get it, make sure you charge your battery for 3 hours. You don't want to overcharge your battery either. A good rule of thumb is for every 10 to 15 patients, charge your light or charge your battery for 3 hours. So come in at 9 o'clock in the morning, unplug it when you go for lunch. It's good for your next 10 to 15 patients. Okay. I'm getting ahead of myself, and there we go. Yeah, this isn't the typical type of battery that you want to totally drain. I know that's what we're used to. This type of battery does best at only a partial, you know, going down to about 50% charge, then recharging it. This battery really, the light is good. You know, it's got a USB port. You can use it while plugged in. It's very convenient. These are just good rule of thumbs. Another idea too is if you're leaving for a significant amount of time going on vacation, take the battery out and just put it in a Tupperware container, store it in a dark, dry place. And recharge at least every 3 months if you're not using it, just to make sure that because it'll slowly seep out. So you want to make sure that you preserve it. The battery is good for 300 hours, which is pretty significant considering, you know, you're only using it for 2 minutes per patient. And then you can the light is still good. You just would need to replace the battery. So the longevity of the composites. The number one cause that some people have of it hardening improperly is sunlight. You don't want to store this directly in the sun. It heats it up and it can just affect the composite as well as cause evaporation from for the primer. So don't store directly in sunlight. Make sure that it's not overly exposed to air. When you've used it, make sure you put your caps back on. I mean, I think that's pretty common sense. And the other thing is heat. Too much heat, if you're storing it in a hot place, it can cause the ONIFIX to become liquidy. You're much better off to store it in a cool, dry place. You can even store it in the fridge. It just makes it a little bit harder to shape, but it will definitely keep the integrity. I personally keep mine at room temperature, and it's always been fantastic. So one full cycle, you have to tell your patients, you know, physics is physics. If you're going to, you know, beat at the ONIFIX strip, it's on there pretty darn strong, but patients, you know, sometimes children will pick at it. Tell them to leave it alone, and tell them to expect if they do have very thin or brittle nails, it may dislodge, and that's not necessarily unexpected. Most offices will say if it comes off before 3 months and there's no obvious sign of trauma, they'll replace it because it is lasting. It's supposed to last longer than that. So we'll get into that in just a moment. But remember that, tell your patient when it does reach the distal third portion of the nail, it is absolutely normal for it to fall off, and that's when you put on your next strip. So just a little bit of a few results from a multi-center clinical observation study done. So this is the required time of application. I find this very convenient. Even this shows that after only a couple of practices, most practitioners are putting the ONIFIX strip on in less than 6 minutes. For myself, it's between 4 and 5. And it's so convenient because if somebody comes in with an ingrown toenail, you know, I don't need to send them home and rebook and have them come back, big schmozzle. I just can literally add 5 minutes to their appointment time, and they've got their ONIFIX strip on and their treatment's already underway. This is looking at the effectiveness with nail deformations. It's a reverse chart that shows the most severe curvature at the beginning, and by week 6, already a significant decline with the optimal effectiveness at week 36. This is looking at nail bed changes. So pretty much the subsequent aggravation of the nail bed from that involuted nail constantly rubbing, you know, in the sulci, it gets really irritated, or, you know, callousing starts to form in there. So we really see a steady decline with that. I start to notice this with my patients right away. Effectiveness with pain. This is a big one. At the start of the study, we noticed about a 60% report of nail pain, and by week 6, it was already down to a reported 1%. I have to tell you, in my practice, my ONIFIX results have been very, very consistent. So you will experience immediate acute pain relief if you're using that distal half strip when a patient has just had an ingrown toenail. When you put that proximal strip for long-term correction, they're not going to notice it right away, but they will notice it, you know, after 3 to 4 weeks. They'll start to report, yeah, they're not pinching like they usually do. And the longer the ONIFIX is on and the further they get through the course of the treatments, they don't even notice it anymore. So it's really, really I love it. What I love as a practitioner though, is when I have a patient come in 2 months after having the Onifix on, because at that point you can actually feel when you get your curette in there, if it's a long-term patient, you know their feet really well, you can actually feel the difference, how it's not nearly as tight. There's not nearly that aggravation, and your patients aren't experiencing nearly as much pain, not only in their daily life, but those treatments that they come in for, they're not terribly pleasant for them, you know, with a deep involuted nail and you have to, you know, clear it out and clean it out. They all report a marked decrease in discomfort during those procedures. So that is absolutely wonderful as well. I have to say that I've mentioned in previous lectures and that during COVID, we had a 3-month period where we could only practice if there was an emergency. And I'm very pleased to report that not one single patient that I had with the Onifix strip put on prior to COVID. These are patients that usually see me once a month and would have complications if they didn't see me once a month. After 3 months with the Onifix on, not one of them had an ingrown toenail. And their verbiage, it's so cute, you know, their verbiage, they don't remember it's called Onifix, but they would say, all of them would say the same thing, you know, oh, you know, it's a good thing you put that strip on me before COVID hit. I think it got me through. And you know what, I couldn't agree more. I absolutely couldn't agree more. My patients are thrilled with this product. I am thrilled with this product. It's safer. It's just, I can't tell you enough how much it's benefited them and my practice. So overall, the effectiveness of the nail correction system, they just asked the participants to rate their satisfaction, and it was 100% at 24 weeks. That speaks for itself. All right, pictures, pictures, pictures. We're happy to provide you with pictures when you purchase the system. You just need to request them. But this is the bomb. This is how you actually get through to your patients. You can explain Onifix to your heart's content. And they seem like they understand, but they kind of have this furrow between their brows. They're not quite getting what you're saying until you pull out the pictures. I have mine on glossy, high resolution paper. So as I'm explaining it to them, I show them the pictures and it's like a light bulb and they go, oh, now I understand what you're saying. Keep in mind, we forget they're not, you know, foot care professionals. So we have to, this really helps. These visual aids really help. Another little tip for you too, when you have a really severe pincer nail or really severely involuted nail, if you want to kickstart their Onifix treatment, put two full strips on to start. I usually put one right at the base, right at the proximal, and then one about halfway up so it'll last. The top one will not stay on for nearly as long as the bottom one, but it does kickstart their treatment and does reduce their pain. If they're really, really tight distally, this is very, very helpful. So moving on to frequently asked questions, because this is a recorded session. I've taught many of these webinars. I'm pretty familiar with maybe some of the questions that are going through your mind. Let me try and answer them for you.
It's everything you wished for. Your site traffic is skyrocketing until this.
So what is the downtime for my patients after having the Onifix applied? Zero downtime. From the moment that Onifix is hardened, your patients are free to do whatever it was they wanted to do. If they want to go run, jump, go to the gym, go in a hot tub, go dancing, go skating, there is no downtime whatsoever. Are there any contraindications to using Onifix? No, there's not. It doesn't provide torque. There's no suction cups. There's nothing dangerous for our patients with peripheral neuropathy, and it doesn't touch the skin. So there have been no known reported allergies. There are no contraindications. So this has been used on pregnant women, babies, severe diabetics with previous amputations. There are no contraindications. It's safe for them. Can I get the Onifix wet? Yes. Can my patients wear nail polish over top of the Onifix strip? Yes, but it can only be regular polish that can be removed with acetone. You absolutely can't use gel or shellac or anything that needs to be debrided, because if you debride the nail to get that polish off, you'll probably take the Onifix strip off. So make sure they know to use just something that can be removed with polish. Can I use Onifix on an infected toe? That's going to be up to your discretion. Do you remember how I said the Onifix really is affected by any sort of fluids or body fluids or sweat or oils. If you've just removed a teeny tiny little spicule and there's no bleeding or it's just irritated, yes, absolutely. In fact, the Onifix might help with that irritated tissue. However, if you've got a full-blown infection and there's, it's pussy or sanguineous fluid, you just need to let them go have some antibiotics, have it dry out, and then put the Onifix on. Can I use the Onifix on a thick graphotic or fungal nail? Yes, absolutely. So do you remember me saying the Onifix hard, it doesn't really like the thin nails. It can pop off. So soft is a better choice for those thin nails, but the Onifix hard loves a stable base. So the thicker the nail, the Onifix will just stay on there right to the bitter end, right to the tip. It loves those big, thick nails. And can I use Onifix on a pincer nail? Absolutely. Try doing that double strip that I suggested just to kickstart that treatment. What's the best timeline to have my patients come back for a follow-up? That's a great question. Thanks for asking. If it's not a regular patient that you're seeing monthly or every 2 months, I recommend seeing your patient at the 6-week mark. And that's simply because a lot of times they still have some distal pinching. So when they come, you can just clear it out with your black spot, with your curette, and just provide a little bit of that distal relief. Unless you've done a double strip, then you probably won't need to do that. But 6 weeks after that is the 3-month mark. And I would have them come back then because at that point, the proximal strip will now be quite distal and you can put on another strip. I personally, I have a 6-week waiting period. I don't get a lunch if somebody calls me and says, my Onifix fell off, can you put it on right now? I don't like to be hangry, so I plan it out. They're only going to benefit from having 2 strips on at the 3-month mark. I have them come on, and even if the other strip is still on and only say halfway up the nail, I will put another strip on proximally, leave the distal strip on. Just tell your patient they'll only benefit from having 2, and that way when the distal one falls off, there's no rush, there's no mad rush, it's not disorganized. And then I see my patient every 3 months after that to put on another strip. Now, keep in mind, that's with a young, healthy patient. It's really patient specific. If it's an old graphotic nail that's just moving so slowly, you might not need to see that patient again for 5 or 6 months for it to have grown out, but use your discretion. What is the expiration date of the product? That's a great question. So because it comes in a starter pack, we have to put the expiration date of the very first product that's going to expire. And in this case, it tends to be the primer because it's a fluid and can evaporate. Now, there's not been an issue with it, the product degrading at all. It's just, it can evaporate. So it's typically about a year, depending on the lot that you get. The compound would be longer. How long will each band of Onifix stay on? That is very patient dependent. 25-year-old, typically it will fall off when it reaches that distal third portion of the nail. How long it takes to get to that distal third portion of the nail depends on your patient. So if it's a young patient, it could be, 4 months. If it's an elder patient, I've seen it stay on for at least 8 months at a time. So it all depends on how quickly that nail grows out. How many bands of Onifix will it take to correct the involution? I typically tell my patients you're looking at, especially if it's a severe involution, just bet on just over a year. Now, how many strips will that take? That depends. If it's a very slow moving nail, it might only mean 2 strips. If it's a quicker moving nail, it might mean 4. I haven't met anyone that's needed more than 4 strips, but yeah, that would be typically, you can't guess. So you just have to give them sort of guidelines, and that's the guidelines that I give my patients. If I have a clinical question, what should I do? Who should I contact? We will also be included a commonly asked questions list, as well as the clinical video for you to review. You can go to www.onifix.
I think we can end it now, Sarah.
Put your questions in there. David Zuck.
Perfect.
All right, we'll just wait for Sarah to come back.
I had myself double muted as usual. All right, just a sec. I am getting back into my office here. All right, and we're back. So perfect. And I love like the frequently asked questions, Bree. Probably took care of some of the questions that maybe are going to come through here in the next couple of minutes, but let's go ahead and get to them. I don't know how many. Okay, so we actually don't have too many, but we'll just get this party started. So what about the question of having to use it forever?
I didn't read the question. What's the question? What about the question of having to use it forever? No, absolutely not. So once you have corrected the involution, unless there's a biomechanical issue, I mean, if they're walking around in high heels or really constrictive cowboy boots or something like that, then of course re-involution can occur. But no, typically the majority of patients, we're not finding, once you've corrected the involution, it's not reoccurring. So for a pretty significant involution, you're looking probably about 4 strips.
And this next question, Bree, David, you might have to chime in here because I don't know the differences between Canada and the US. Reimbursement information, is there reimbursement for Onfix? That's one that I actually remember.
Can you hear me? Can you hear
Yes.
me? I just wanted to make a comment because I was muted, so I unmuted myself. Is you've got to look at this because it's an unusual mindset. This procedure is in longevity so far is equivalent to doing a matrixectomy. Once the involution or incurvation is resolved, it's resolved. The number one reason for getting ingrown toenail is improper cutting of nails. Don't go into the side of your nails, and they're self-inflicted, most ingrown toenails. So that being said, I'll move on to the reimbursement. In the United States, it's what the market dictates. Typically, it's it could be $75 to $200 a strip. It all depends. And Bree, what would you say the average is? 3 to 4 strips for severe?
Yeah, at least 4. I say 4 and just prepare my patients for that. And considering each one is on for 4 to 5 months, typically it is a long procedure. They have the strips on, but the strips are painless. Most of my patients forget they're even there. And my patients love this product. I didn't watch the recording. I probably said that in my recording, but they love it. They love it.
You didn't say that. You turned on the procedure. I could not believe this recording of what you said about this procedure. It was like it was the evil Bree. No, but I want to go back to the pricing, and that's everybody. It's not that important what the price is. You have to pick a price that's fair to you and fair to your patient. I personally, if I was in practice today, I'd do a package. It's a full year of treatment is X amount of dollars, and I pop them on when I want to pop it on. It costs about $6 per strip. That's your product fee, and maybe 6 minutes of your time.
Less.
Okay.
Less. I can do
like
2 strips and I can do 2 strips in less than 5 minutes.
Okay, so it's a quick, fast procedure, very effective, long term. I'm just amazed. I mean, today my assistant was on vacation, so I did the shipping. And I got to tell you something. I hate this product because I never shipped so many refills. The refills are what you buy, and they're very, very reasonable. I mean, what's the economics? Then we figured out a starter kit brings in about $6,000 to $8,000, and you're paying for how many treatments are in a refill?
There's 40 treatments per tube.
Okay.
So
and
40 times 75 would be the minimum that you would be making.
And you're paying a minimum to get it. Trust me. I was, ready to say, I want to triple the price of this. It's a lot of work. It's a lot of work to provide this treatment, and I'm happy to do it, and I'm honored to do it. But again, we're getting back to fees. This product is so reasonably priced for the market, so reasonably priced. Can you name a product that you can spend money on and it has such a high return? $6,000 to $8,000, and what's it cost? What is the price? $697.
$6.97 or $6.99, I think. Yeah.
Yeah, I don't know anything like that, except,
Hey, David, can you scooch over? Your head is like being.
I know
chopped
it's hard for me because I'm on my, I'll go on my lap. How's this?
off.
It's tough. Wait a minute.
Fine.
I got an idea. Hold it. I can't get in. Anyway, I was gonna put it, it's hard.
You're fine. I should have just let it ride.
I'm a midget.
No, that's good. No, you're good.
Oh, I
I
know what to do. I can
apologize.
fix it. I got an idea. Hold it. I'm
Well-
gonna open the,
If I can kick in, I
Yes.
think it's such an important point that David is making. Before we
How's
started
that?
having technical difficulties. Bottom line is the initial starter kit is $6.99. But it comes with 80 treatments in it. Which that's where he's getting the $6,000 to $8,000. Once you have that, you never need to repurchase the starter kit again. Then you're only buying these tubes. I believe, please don't quote me, they're around $150 or maybe even a little bit less, 120 for the tubes. And there's 40 treatments per
about
tube. So
120.
you can see that it's extremely economical and the system just keeps building on itself.
How's that?
Perfect. Thank you.
Perfect. Time to go. No, just kidding.
I
Yeah,
have
exactly.
to
Now
tell you
now
something,
that
and
you're
I
all
should
set
be-
up and we have no more
I-
questions.
I've come to, I gotta tell you something, and it's, I'll probably get slapped for this. I hope Kat's not on tonight. There's no better profit legally than this product. You'd have to do a little bit of illegal selling of some certain substances in your office to get this kind of profit. In other words, a bag of weed probably can't make this much. Okay.
Did you smoke weed? So, Bree, you were talking about, and both of you were talking about the ease of the process and the time. How long does it take for a new physician who just started to really get good at it, to do it in
That's a
that
good
under-
question.
It doesn't take long. Usually after probably 3 or 4 applications, it's very easy to use. So the hard product, I'll give you a couple of tips. I don't think that were in that video. The hard product is more like a putty. So what I would recommend for you is putting that putty on, or the resin onto the nail, leave it for 30 seconds when you're dealing with the hard. The body heat itself heats up the resin and makes it much more malleable. If it's especially cold in your office, the Onifix hard can, it'll be sticky, very tacky. And so it's much easier to use if you just let the body heat it up by itself. Typically what I do, because most patients that come in with an involuted, say hallux, have 2 involuted halluxes. It's usually bilateral, at least in my experience. So what I'll do, they want, Onifix on both toes. What I'll do is I'll put the resin on this one, then I'll prepare this toe, I'll put the resin on this one, I'll shape the resin, and it's very, very quickly. And the nice thing about this product too is that your staff can do it. It's so simple. And we have a system, a recording where we can train them, show them how to use it. And really, yeah, it really just needs the podiatrist to make the diagnosis and suggest the treatment, and your assistants are more than capable of taking it from there.
Yeah.
Are there any other products that you have to use in conjunction with it to make it work better? Or
There's nothing that you have to use in conjunction, but I strongly recommend for another webinar sometime looking at the Poto Expert line. So for example, if you, let's say you are, a lot of nails that you use the Onifix, they're just unhealthy. They're dry, they're brittle. Using the Poto Expert tincture spray, it just infuses the nail, and they work very, very well together. In addition to that, the tincture spray has pyroxenolamine, which helps fight fungus. So we can talk about those products another time, but the 2 lines, Neuberg introduced them together because they work so well together. Oh, you're muted, David.
you're muted, David. But we can see your whole face now.
Because I'm mouth syncing. Let me ask you a question. You get the product, okay? Everybody's going to be a little, even though it seems simple and it should be simple, how do you really get started? You pick one of your staff members, set some time. I want you to add into this, where you set a little time and you practice on each other, right?
You can. Yep, you can.
What else would you do?
That's all we did. When I went to Germany, the group of us, yeah, we tried our very first strip on each other. It really is a very simple process, as long as you're paying attention and you're not skipping steps. What you'll find is that as you put more Onifix strips on, you'll just need to do less filing after. Like at this point, like normally you need to file it because it might be bumpy, it might not be perfectly smooth. At this point, I rarely need to do more than a quick swipe over the top to make sure, because it just comes naturally you can shape it easier and quicker.
I
I
think
also, oh, go ahead.
it sounds like it's just a very simple procedure. I've never
It
had
is. It is.
anybody say to
It's
me,
super
I
easy.
can't do it. You
Pardon
know,
me?
I've never had, and how many years has this product been in the podiatry market? It seems like forever, 2 years, 3 years. It's been a while. It has to be longer because we've had reports back from doctors where they have 3-year follow-ups on Onifix.
Don't forget, it's been used in Europe for a very, very long time. It came to Canada in 2000, I want to say 2019.
And then
We started, and then probably 6 or 8 months later, we
Yeah.
went into the US. Yeah.
So,
think we
yeah,
have-
we just had the insurance question again. I don't know.
yeah, I didn't answer that correctly.
Right.
So, or I didn't give enough information.
Right,
I
yeah.
got a little distracted. What about the question used for everyone? Is it covered by any insurance? No, it's not at this time. But
It's
you
too new
know,
a product.
it's not even that there. I have people that are talking about it. We really don't want it covered, to tell you the truth. It's not thousands of dollars. It's it's hundreds of dollars. So I don't know if once you start doing it and seeing it and believing it, you're not gonna, that question won't come up. But I understand it. But you can do what we call evaluation management. You shouldn't just bill an office visit for it. That is not proper documentation. But for the initial evaluation, you could do the initial evaluation and put the first strip on and do it that way, or charge additional. I know every practice is different and every area is different, but you could do that. So generally speaking, it's not covered. And if your problem is that the patients are saying, why isn't it covered? You can show them the medical policy. That's what you got to do. I don't think, I don't know, it all depends on your practice. If anybody wants to have a, private conversation about that, because I talk to doctors every single day. And I find that, we tend to focus on the 1 or 2 as opposed to the 8 that accept it.
Mhm.
It's really that it's really that simple. I hope I answered the question. I'm not trying to avoid it. I'm trying to learn how to use this thing here. So is it covered by any insurance?
Like you
No.
said, it is what it is. If the good thing is there have been so many presentations on how to build cash practices. And so
Yes,
right
this is part of it. It's
Mhm.
interesting. I just got an email not too long ago from a Dr. Greenberg. I think it was from the state of Washington. I'll never forget this. He did house calls and skilled nursing homes, and we referred him somebody. He says, I can't do it. I don't have an office. And I didn't even know it, and he's been doing cash in skilled nursing homes or homes for 3 years. And his comment was that over 90% of his patients accept it and they are getting great outcomes.
And I just wanted to mention really quickly, because we don't have a whole lot of other questions coming in. So as I'm chatting here over the next minute or so, feel free to get in your last minute questions if you've got anything for David and Bree. But we do, obviously this is Practice Partner Academy with podiatrymeetings.com, but David and Bree do a regular troubleshooting tips and tricks with both Onifix and PhotoExpert, which was mentioned just a little bit ago, but it gets into that a little bit deeper. And our next one is June 6th, I believe. And so if you go to zuckermanonifix.com and webinars, you can register for that. So I can pull that up here. Let me share my screen. see. I don't know if I can
There-
share my screen.
There was something else I just wanted to reiterate too. You know, if you're interested, after, you know, the presentation tonight, we do have an hour-long video, a link right to it, that will be even more inclusive, including clinical videos that you can watch me applying the product. It's right on the site, right on Zuckerman. The site just changed, onifixusa.com. Now it's zuckermanonifixusa.com.
Zuckerman
if you go-
Onifix. It's just Zuckerman Onifix. I don't believe that there's no USA on it. It's just Zuckerman
Okay.
Onifix.
But anyways, we've worked really hard to make this a very, very helpful and supportive site. We've got the frequently asked questions page. We've got marketing that you can use that Sarah's developed, brochures, pamphlets, information that you can hand out to your patient. You're always free to contact us and, you know, with any questions that you might have. It's really important to us to make sure that you're supported. Should you choose to purchase, again, you go to the website for professionals only. So your password is going to be Zuckerman with a capital Z.
And that's Z for us Americans.
Yes. I can never remember.
When you said that the first time, a long time ago, I was like, that's a joke, right? I had no idea that Z in Canada was Z. Like, that's just like, I still think you're making it up and like playing a prank on me.
I am just kidding.
I know, right? That makes sense. So, but all right, well, we don't have any other questions that came through. So obviously I wanted to thank Bree and David and Zuckerman Future Technologies in combination with Onifix for the presentation. It's a really good presentation, obviously, and with every month, because outside of Practice Partner Academy, I'm so used to just watching the tricks and troubleshooting. So it's kind of nice to kind of go back to basics and
It is.
and relive some of those, just the initial training. And keep in mind that you can, obviously, we always have our Practice Partner Academy archives on our website. Don't forget that, actually, I'm going to share my screen one more time here. Give me just a second to do that. I just want to remind everybody that you can go to our marketplace at podiatrymeetings.com and you can find the Onifix nail correction system. There's Bree. Look at Bree looking so pretty.
Oh, God.
And so there's information on both Onifix and PhotoExpert on this page. So
Where
you
am
can, well, you're on the Remy page. We could
Where's my
So-
head?
yeah. So there you go.
Oh, there's my head.
So obviously you can go here, but you can do ZuckermanOnifix.com. But if you do go to our site, you can, it does lead you back to that site as well. So there's all sorts of ways to get the information you need. And these presentations, they're not popping up right now. My computer's running.
Really nice.
But the training video will populate there as soon as my computer stops having, like, my computer's like overheating right now. So
Can I ask you an opinion?
Sure.
How about the way I've placed my iPad? Do I still look like just a head?
Oh, you're good. You're good. We're wrapping it up anyway. So. All right. Well, David, Bree, did you guys have anything else that you wanted to leave us with before we sign off?
Yeah.
Again, the recording will be on the archives. If you want to order, ZuckermanOnifix.com, or you can contact David at David Zuckerman DPM@gmail.com. Obviously, you can reach out to us as well. We can always give that information. So whatever you need, we'll get you taken care of.
Okay. Thank you.
You're good? Bree, good?
Good,
Yep.
thank you.
All right. Thanks, everybody who joined us. Thank you for staying on till the bitter end. And we'll keep you posted on our next Practice Partner Academy session. Thanks. Have a good night.
Thank
Yep.
you.